Good morning, everybody, and welcome to today's webinar entitled Wave 4 of COVID-19, Supporting Emotional Well-Being and Mental Health of Patients and Families. I'm Isabel Jordan, and I'm the Embedded Patient Partner here at CFHI, and I'm really happy to be your host here today. First of all, I'd just really like to thank you all for your patience this morning as we worked through a few technical glitches that were unexpected, but maybe expected given everything on the internet lately. Before we begin, I would like to start by acknowledging that as we gather here from across the country, that we're all meeting on land that's been inhabited by Indigenous peoples here for a time immemorial. I'm personally broadcasting from this webinar from Squamish, BC, which is the traditional and unceded land of the Squamish Nation, and we recognize their traditional, historic, and current connection to this place. And I personally appreciate the opportunity that I have to live, learn, and play here on their traditional territory. So I really like to personally take a moment to really appreciate that and be mindful of that. We at CFHI are pleased to host this webinar bilingually. The telephone number to connect to the French audio is on the screen. We invite you to use either official language when entering your questions and comments in the chat box, and we have simultaneous interpretation to help us moderate that in both official languages. So as we move forward, I would like to kind of go over how we're going to be moving along this webinar. So we'll be focusing on patients and families, but we recognize, of course, that there are significant and far-reaching mental health impacts to those working in healthcare that also need to be addressed. And while it's out of the scope of today's conversation, it's really important to recognize that these mental health impacts also need to be addressed, but it's not in the scope of the short 1 hour we have together today, but something that definitely needs to be addressed as well. So in today's webinar, we'll be discussing and talking about the importance of maintaining the lived experience perspective in decision-making circles, ensuring that this crucial expertise that's been so long fought to be included is not lost now in this time of pandemic, as we're often talking about it. We'll be talking about how the mental health of patients and families is being affected by so much during this time, how isolation, anxiety about the future, about health and safety, but also about how changing policies that limit access to care and to therapies and to changes in care delivery have affected the mental health and well-being of patients and families. A lack of involvement in how these decisions are being made is really being affected. So these effects are happening now as we speak, and they're also, they'll be far-reaching into the future, especially to folks who already live with mental health trauma and medical PTSD as feeling increased effects, but also lots of people are going to be feeling new mental health effects and new trauma will be experienced as things are changing and have been changed. Our guest speaker, Yona Lunsky, will be talking about the intersection between mental health and patient and family engagement. And importantly, we'll be describing exactly the title of this webinar, this fourth wave of COVID, what it means and what exactly we'll be talking about. And I'm really looking forward to that. And then we'll be moving on to really the meat and potatoes of this webinar, which is our discussion and conversation, with an amazing group of people gathered here today. That we'll be talking about. And I think that's going to be the real idea generation that we'll get to have, and this idea of building solutions together as we go. So moving on to really maintaining this lived experience. So as I mentioned, I'm patient partner at CFHI, and I come to this with a lived experience. So my personal history is that I come into this as a caregiver of somebody with a rare disease, and a person who lives with rare disease and with disability myself. And you know, my perspective in kind of doing this work for the past over a decade is that, you know, we've really been on a wave of change where patient and family engagement I feel, has been really making headway in how changes and decisions have been made, and including lived experience as a key perspective in decision making. It's been increasingly recognized as that extra little piece that's been left out and now has been more included and been looked at as a crucial piece of the puzzle. However, the speed the pandemic has come, the changes that have had to be made, and the need to react quickly, and it's been necessary and understandable, but this wall has come down between decision makers and the people who have been most affected by the decision. And the speed has been necessary, but I think increasingly we've all realized, everybody, not just patients and families, but also people in healthcare and decision-making circles and the public in general, that where we are now is not a sprint, but a marathon. And we need to talk about how we get back to the proper principles of good patient and family engagement and why it's so important to maintain them. So kind of bringing this back to my own lived experience and how this has been affecting my mental health and my family's mental health. We're a complex and complicated family. We live with physical disability, with mental health disability, with chronic pain. Lots of decisions that have been made quickly have seen us lose access to essential pain management services, see us lose access to healthcare delivery. Our family, because we're vulnerable, we're in a variety of ways particularly vulnerable to COVID-19, have seen us bubble wrap ourselves and been re-traumatized from a mental health point of view, and also found ourselves in a very familiar place of isolation because we've been in the ICU, we've been in the PICU with our son. We found ourselves in a world where we know what it's like to need to be safe around when there's respiratory viruses for our own health. We know what it's like to live in a world of uncertainty when it comes to medical health, and to see the world catch up around us, to feel the same kind of uncertainty it puts us in a strange state of feeling like the world finally understands what we feel like, and yet in another way of being in a heightened state of uncertainty as well. So we find ourselves in this whole new world of being even more confused by everything. Anyhow, as a person that's embedded in the system, I can see how talking to people like me and by other people who are even more vulnerable, it's really important to continue to make better decisions. I would like to hand over the mic to my co-host, Métis Elder Denise McQuaig, to continue our introduction and to share with us about maintaining the importance of her lived experience and her expertise of community at decision-making table. So thank you very much, Denise. I'll just flip over to your slide and away you go.
Thank you, Isabel.
Oh, sorry for that.
Everyone. Tempe, everyone. I'm here in Kamloops, BC on Secwepemc territory, and happy to be able to share with you today. I am Denise McQuaig, the granddaughter of Lillian Belrose and Herman Isaac of St. Albert, Alberta. And as Isabel said, I am a Métis elder who works with CFHI as a coach in other collaboratives. I wanted to talk a little bit about my elder, my mother and my mother-in-law specifically. My mom is in a picture with my father on the left of your screen, and my mother-in-law, Georgie, on the right side of your screen. My mother is a recent widow. We lost my father in November of this past year, and I'm supporting her from afar. So I'm a 9-hour drive from her, and she has completely isolated herself. So she is not even going out to get her own groceries. She is being supported to do that. She has not left her home since the 16th of March. And as a result, the grief of being a new widow is much more pronounced. She had built up a group of support for herself, quilting ladies on Wednesdays, coffee ladies on Thursdays, connections with her children and her grandchildren over the weekend. And that has been completely diminished. And so her total isolation, that feeling of grief, the loss of my father, is just absolutely profound. And I think one of the things that's further compounding it for her is that we lost my father to asphyxiated pneumonia, a complication of a stroke. And as she listens to the descriptors of COVID-19 and hears that patients with this influenza are struggling for their breath, she's brought back to those moments of supporting a loved one at their last time, struggling for their breath. For my mother-in-law, her perspective is quite different. She lost both of her grandparents, whom she never knew, in the early 1920s to the Spanish influenza. Her mother then grew up 18 years of her life at Cooper Island Residential School as an orphan with no parents to return to, and put her up for adoption at the age of 2, where she was raised away from her culture. At 87 years of age, she still finds every opportunity she can to leave the house despite my begging her not to. And she says to me that she's comfortable at 87 with the thought of passing, that she believes Creator has a plan, and when it's her time, she will be ready. But the one thing that she can't stand the thought of is dying of loneliness. And so for both of these elders, they have a true lived experience with pandemic that impacted their childhood lives and their current lives in a way that I don't have in my wheelhouse, a memory to connect to in that way. And it made me think about my own lived experience. I live with bipolar disorder and post-traumatic stress disorder, and how social isolation is one of the things that I struggle not to do in my illness, because it can lead very quickly to a depressive state for myself. And the challenges of suffering from the anxieties of PTSD in looking at how I would support my elders should they need me. So with that in thought, it led me to think about the continuum of cultural safety, and I thank my colleague Kelly Brownville from Flat Bay, Newfoundland, the Mi'kmaq Nation, and a Maori nurse who created this lovely slide. And with cultural safety, I think what's important is that the stressor is on the health service provider to unpack their backpack, to look at what their biases are, to look at what their understandings are of another individual's culture and how that applies in the situation. And then also I think what's important at this time is trauma-informed care. And how I separate out cultural safety from trauma-informed care is that I think of cultural safety as unpacking your backpack and reflecting on your practice, but I think of trauma-informed care as reflecting on the patient's experience. And one of the things that I'm mindful of is that should I be called upon to try and support my elders during this time, I would need to do so from a distance. And that causes a fair bit of anxiety for me because I have great trust in medical professionals to know what to do medically. But what I don't have a lot of confidence and faith in is that they're going to meet the spiritual and mental needs of my elder at a time when I couldn't potentially be bedside. And so I recognize that due to personal protective equipment, they can't engage their smile with the patient, which is often so important, that patients may become at their most critical time of health nonverbal, and not be able to take those facial cues that they normally would rely on. And then I recognize that when the health professional is reaching out to me, they tend to focus right in on the problem. So this is what's happening with your loved one, and this is our proposed solution. And what's missing is the nuance that I would get from being at their bedside about what's going well for them in their day. And so we don't get an opportunity to take a strengths-based approach, which I think feeds into the anxiety of us as patients, caregivers, and families. So to summarize, spiritual and mental health is something I think that as caregivers and families we provide to our loved ones when they are patients. Anxiety for me is in the struggle of how to do that through the wave 4 of the continuum of the pandemic that we're facing now, and look forward to some discussion about how in this time of uncertainty we could take a strengths-based approach into the future. So I'm going to turn things over now to Dr. Yona Lunsky. Yona is a psychologist with CAMH, the Center for Addictions and Mental Health, and I look forward to her taking us through the waves of the pandemic. Yona?
I said all of the smartest things, like the best part of the talk is done. All right, I'll try to recreate it. I'm Yona. I'm from CAMH, where mental health is health, really recognizing how vital, I guess, thinking about our mental health is during this pandemic. And I'm really honored to be able to share a few words with everyone, sort of reflecting on this concept of wave 4. I thought it would be helpful because we talk about wave 4, but we may not all be talking about exactly the same thing, and we may not know why it's wave 4 and not wave 3 or wave 2. So I thought I would just show a slide that sort of captures, sorry, I'm just trying to get my cursor to go to the next slide. So here we go. There we go. So this is actually something that I saw on Twitter around, I think it was posted on March the 30th by Victor Tsang. And it sort of gives you a visual of these 4 waves. And I'm just going to very quickly sort of explain what they mean and why we call the last wave, the one we're talking about today, the 4th wave. So when we think about pandemic and we think about COVID, we focus on this purple sort of very narrow little mountain there, which is that immediate wave of trying to control this pandemic, reduce morbidity, and certainly mortality for people who do get sick. But at the same time that we're doing that, we see our 2nd and our 3rd waves. So the 2nd wave is the green one, and it's focusing on all those surgeries and really important things that were supposed to happen in healthcare that have been delayed or postponed. The 3rd wave is looking not so much at sort of urgent or required care, but ongoing care that you give for any kind of chronic condition, whether it's a physical health condition or a mental health condition. And you can see that these exact figures for where the lines are drawn are hypothetical because we're living in this pandemic right now. We don't really know where it's going to go. But what this figure is really trying to illustrate is that we don't just have that 1st wave to deal with, but all these ripple effects are things that happen after. And if we look at the 4th wave, it actually sort of starts almost at the same time as the 1st wave when we started addressing COVID, and it goes up and it stays up. Right? So whereas those other 2 waves we spoke about maybe start a little bit later and there's a bit of a mountain and then it subsides, this idea around the trauma that people are going through, how it's impacting our mental health, is something that has already started and it's not going down anytime soon. So the question is, how does this fit with the concept of patient and family engagement? And I guess what I want to say is sometimes we think, and we heard about, Isabel mentioned the wall, that sometimes pandemic started, so all that work we were doing around patient and family engagement, some of that really just has to pause because we've got a pandemic, right? So do we wait for sort of dealing with how we address patient and family engagement after wave 2, after wave 3? Do we go all the way to where that man is, or woman is sitting in a chair at wave 4? Or do we actually need to deal with these issues around patient and family engagement right away, right at the beginning, sort of avoiding that wall maybe that's kind of come up, preventing some of those things from happening? And I would say that at its essence, you know, this is exactly the time where it's most difficult for us to do patient and family engagement, where we need to do patient and family engagement. And I think what keeping that in mind will help us with will make sort of how high that red line goes and how long it stays that high for. So the more engaging we can do, if we can do it well, I think we can actually change how all of these waves of COVID are impacting our mental health and help us to address mental health, not just now, but in the long term. So I thought I would just sort of give a few examples of things that have clearly changed around how we do our patient and family engagement and why that impacts our mental health. And then I want to talk about what has not changed and just offer a few suggestions on some things that we can do. So clearly, even the pace at which I'm speaking has changed, and the pace at which we respond and we engage has changed. On the one hand, you know, we're slowing down, we're stopping some of our patient and family engagement activities, so the pace is slower. But on the other hand, and sometimes it's just completely stopped, the pace is actually much faster because people need to respond right away. We have something, we want your opinion, but we need it right now because we have to post it by the end of today. Okay, and that's a really sort of confusing thing emotionally for all of us to deal with, to have this sense of frenzy as well as a sense of helplessness because things are stopped. The platforms and the structures in which we engage with have also changed. So some of us are used to and have built really strong relationships through meeting either in a neutral space outside of the hospital for creating or building a space within a hospital or a healthcare setting. And we don't meet in person anymore to do any of these things. And some people find that super helpful. That's actually reducing some of the stresses of maybe having to go and park and deal with being in a certain kind of place. Other people find that incredibly difficult. So, you know, today we're using Adobe Connect as a platform. Some of you may have been using Zoom or WebEx or Teams. They're all different. And some of us can read well. Some of us can type quickly. Some of us can listen well on the screen, and some of us can't. So the change in our platforms and structures of how we meet has become a major stressor, I think, for anyone involved in the patient and the family engagement experience. What we focus on has also changed. So some of the topics we thought were really important, we're being told have to pause right now, and there are new emerging issues coming up that we have to respond to quickly. And finally, the demands that we have on our table, you know, to become a patient advocate or a family advocate and contribute your insight is something you're doing while you're balancing the rest of your life. And to make this a priority if you're working in healthcare is also something you're doing as you balance other parts of your job. And now we all have more demands interfering with how we can prioritize this really important issue. This is me working with, there we go. Oops, no, just one more. So how are patient and family engagement actually remaining the same? I just want to take a few moments to remind us that actually at this time, even though things are pausing and walls are going up, having that patient and family voice is absolutely essential. Recognizing that how we're working together and the fact that there were different kinds of power differentials that we needed to recognize before, just because we're all in this together and there's a pandemic doesn't mean those power differentials are suddenly gone. They're there, maybe they're subtle, maybe they're different, but we have to take that into consideration when we try to do our engaging. For example, I'm paid very much to be doing my job right now. Maybe someone who's engaging doesn't have their paid work going on for them anymore, and maybe they don't have the same ability to flex or move in terms of how they're engaging. Both the concept of cultural safety that Denise spoke about and also trauma-informed care, those things don't disappear during a pandemic. It's really important that we keep these things in mind in our engagement. And finally, the way we have our relationships. I had initially written maintaining relationships, but I think we actually have to build them. And sometimes we have to rebuild them now, especially if there's been pauses. And we have to focus on how we strengthen those kinds of relationships. If we forget about that or just assume it's there because the relationship was there before. These are fragile relationships, and I think we have to put a lot of effort into making sure that we make these relationships strong at this very difficult time. So another term, wave 4, is a term we've heard a lot. Another term I've been hearing a lot over this time is the term of pivoting. Because as we think about patient and family engagement, like many other things we're doing in healthcare right now, we have to think about how we pivot. So I think the safe space that people have been working so hard to create or maintain, we actually have to work even harder to make that still a safe space for all of us to engage in together. And people really need to understand that they can come and go into that space as they're able. So whether you're a clinician or a researcher or an administrator who's also dealing with stuff at home, or you're a patient or a family advocate, you need to know in your engagement that you do what you can and it's perfectly okay to step back to be able to take care of yourself and other people in your lives if you need to do that. We have to act fast, and I think one thing that will help us around our engagement is anticipating opportunities that might be coming up so that we can act as quickly and as responsibly as we can. We need to know how we address different types of topics because we can't address everything at once. Having that clear shared understanding of what that process is to pick what we're focusing on, I think will be helpful. There are already so many excellent tips and steps helping us to figure out how we work together. Maybe some of those things have to be adapted now, but seeing that stuff like on the wall in front of us during our meetings and our engagement, I think is really important. And finally, I think we need to be thinking about if we take a really long time to get it exactly right, we don't have time right now. And so sometimes we have to be willing to fail faster so we can make mistakes. In a safe space, we can own the mistakes that we've made, we can learn from them, and we have to be able to pivot again and keep going. So in my last few seconds, I just wanted to put up this illustration. Denise talked again about sort of how often we're focusing on problems, whether it's the problem we have to fix around COVID and patient and family engagement, or at the bedside, the problem that a patient is experiencing. And this is a nice illustration reminding us about that balance for all of us, how often we are problems to be solved versus sunsets to be appreciated, and making sure, as pressured as we feel at this time, that we're achieving that balance. We're appreciating what we're working on together. We're appreciating the person in front of us, and we're making that balance. Okay. And this is just my contact information, and if you're interested in resources around COVID and people with developmental disabilities, the link is there. Thank you.
Thank you, Yona. We're going to move in now to series of 3 questions. The first is going to look at how have things changed for patients, families, and caregivers during this time of COVID. The second will look at how is your organization engaging with patients, families, and caregivers during this time. And the third is what do we need to change or how do we remove any barriers that might be present. So in the time we have left, we have lots of opportunity for discussion, and we encourage you to pose any questions that you may have. Don't feel concerned if we don't get to all of the questions in our time allotted. We'll be able to post this later and have an opportunity to follow up and review that at a later time once it's been posted. So over to you, Isabel.
Thanks, Denise, and thank you, Yona. I really appreciated that last slide of yours to take a pause and reflect and appreciate. I think that is so very important. Before I frame this first question a little bit, I just want to go over kind of how the chat boxes are going to work for the question. What we're going to do is have a chat box for each of the questions. So when this question moves on to the next question, we're going to have a whole new chat box for the next question. And just so you know, when the chat boxes disappear, the information doesn't disappear, and we'll be kind of collating all this information to give to everybody later. So what you put in does not go away. It's just a way to keep us organized with such a big group that has wonderfully taken an hour of their time to join us today. We have to somehow find a way to organize ourselves for this.
So once the question is over, we'll bring in a new chat box. And if you have a thought on the first question and the first question chat box has gone away, you can feel free to put something in about the previous question in the next chat box. We're not constraining you or anything like that. We're happy to keep the conversation going. So anyhow, first, that was a very big entrance into the first chat question. Holy cow. The first question is, it's kind of a very general question, but how have things changed for patients, families, and caregivers since the beginning of the COVID-19 pandemic? So that's kind of a very broad question, and obviously things have changed a lot. But the general frame of that is what we were thinking is, things have changed a lot for us in the patient and family community. They've changed in terms of isolation. They've changed, obviously, in terms of access to care. I talked about a bit of this in the beginning in terms of my own family experience. One thing that happened to me personally is my son lives with a rare disease, and stuff happens to him all the time that we need to go to the hospital as things come up. And one thing that happened with his health was he had a very drastic change in blood pressure. That kind of pre-COVID, we would have gone to the hospital. We would have gone to the ER right away without hesitation. But given fear, we put it off for a week. Kind of trying to manage it at home, and ultimately we ended up going to the ER, where upon, at the entrance to the ER, he just turned 18, it said if you're with an adult patient, they had to go in by themselves, and I was supposed to wait in the car. And that was, I turned to jelly inside, to be honest with you. The thought that I would have to leave him at the door and not be there as his caregiver. So within the context of all these changes, access to care, rules around being in hospitals, that kind of thing, have the needs of patients and families been recognized, and do we have resources to meet those needs or to recognize those changes? So that's the general question. If you could put those in the chat box, and wonderful Haley's going to help us. And I see questions already come up about communication avenues have been changed, with no direction being shared for patients and family. Yeah, communication is a big one, and how to communicate with people. And that's going to be so different depending on who the people are. And again, I can think of an example just in my circle of friends where the communication avenue that would be appropriate for me, going on a FaceTime for a friend of mine and for her grandmother, who had, for a great aunt, they wanted to FaceTime with her husband who was in the hospital, and that just wasn't an avenue that was appropriate for her when she couldn't have family in her home to get her set up for that. Denise, do you have any comments on that?
Yeah, I'm actually seeing some great dialogue about some things that have changed perhaps for the positive. Beth Campbell-Duke shared with us that she's seen some imaging and testing that normally weren't available close to home being allowed to happen in her local hospital, and that's a potential positive. Others have noted that the ability to have telephone appointments with your physician is a nice outcome of the situation that we're in. And so I think as patients and family and caregivers, one of the things that we could be asking systems to focus on is that when we identify these strengths, opportunities, that we find a way to maintain them after COVID, so that we can capitalize on these strengths that have come out of a difficult situation and not have them go back to the way that they previously were.
That's a great point, that there are some things that will really help us in the end. Like, I know there's always a lot of uncertainty. Like, I know, it's funny, you're talking about mental health impacts. For my son's health, he sees all of his specialists an hour and a half away, and suddenly we have phone appointments, and suddenly we have online appointments for him because of COVID-19, which makes a really positive impact for his mental health and his health, that he can have these appointments virtually now. And if this is a positive change that can be maintained, it's going to, long term, it's actually going to be a net benefit to him, which is really great. Yona, there's a great question for you, I think that would be great for you, that has to do with bringing in changes. I think it was Aiden mentioned from PHSA, and I think I came off somebody else, but now I've lost the thread because it goes by too quickly, that post-COVID, no one in the public is going to stand for the answer, such as change is slow in healthcare because everything's changed so quickly. So my question is, can change come quickly and but integrate the patient perspective as well? So I'd love to hear your thoughts on that.
Yeah, I mean, I think we really, what we're seeing in action is an opportunity to challenge, right? I think it's a good point that we can come back to that and say, you know what, actually we can make changes happen, and this is how we're noticing that it's working right now. So is this something we can also move forward with? You know, using this as an example of how changes have happened when they are positive.
That's a great point. Actually, there's a question for me about family engagement being virtually shut out, and they commented that the military, entering military is being allowed to entry to help providers but not families into long-term care facilities. You know, what I find really interesting, I was just listening to something else on the CBC this morning, just on my way to my office space, my socially isolated office space where I have bandwidth, about I think the interesting push will be with patients and families, along with this was an ICU doctor noting how different it was to be in the hospital without the families. I think that recognition that of the support and the integral piece that the family care partners provide there, I think there's a joint message there about the healthcare and the mental health piece on both sides for having the patients and families helping provide the right solutions together.
Yeah, I think as well, one of the things I find really frustrating is how focused everything is on COVID-19 and the potential traumas that we are creating by other health services not being available at this time. So I'm thinking of, you know, cancer patients who can't get surgeries to have their tumors removed, you know, others who are in incredible pain that can't get their needs met. And then just a sobering statistic that I recently heard is that here in BC, we've had a little over 100 deaths related to COVID-19. But since February 16th, the BC Centre for Disease Control actually has reported 946 deaths related to the opioid crisis, which in itself is another pandemic. And it seems like we've lost focus of some of the other important things that we need to be addressing. And so I think that that's a good segue perhaps into our next question.
Yeah. So I'm going to go into the next question and just make a comment about what you said about the mental health trauma, about not, this is a personal story that I don't talk about that much, Denise, but I think it's important in those other effects. So my disability gives me a lot of chronic pain. My main modality for dealing with it is physio. There's a huge mental health effect of living with chronic pain. And I know not just for me, but for many, many others that live with chronic pain, manual therapy is a huge part of mitigating that. And I've now gone the longest I've gone in about 19 years without manual therapy, and day by day my pain gets worse. And day by day my fear that it can never be brought back to the level that I was able to live with grows higher. and my ability to work, my ability to parent. It all depends on keeping our pain under control. And I live a very privileged life. Like I know there are many others in many worse positions than me. So these decisions that are made, like I said, in a hurry, and it's understandable, I just think that we need to bring in patience to help make better decisions. Sorry. So the next question, how is your, so this is both for the people on the call, on the webinar that are in organizations, but also the caregivers and patients that are on the call too. How is your organization engaging with patients and families and now to reduce the potential impact of wave 4 that you want to talk about, which is happening now? It's not a future wave, it's a current and growing and maintaining wave of COVID-19. And then for patients and families, how are we mobilizing and what supports do we need to be heard? So what is happening now? Or what do we need to happen now?
So I noticed that Aidan had an interesting comment that sort of fits with this question a little earlier. He suggested that perhaps we need to be looking at creating some committees that of patients, families, and caregivers that could begin to prioritize what we feel needs to be addressed to support ourselves moving forward in a positive way. So thank you for that suggestion, Aidan. I really like that idea. I know not all provinces have them, but here in BC we do have a patient voice network. And so it would be interesting to see how we could mobilize across the country and elevate those voices to be heard.
Yeah, I know that we heard from Beth about this idea of what different organizations are doing in this regard. So I feel like it might be really nice for us to be able to hear, and both from the patient family side and from the organizational side, examples of what people are doing as they're trying to bring that engagement back in or keep it going. So how have people pivoted? Almost like, you can imagine like little interviews kind of capturing, here's something we tried and it seems to be helpful. Here's the thing we've been doing. I know that we switched. We have virtual meetings that include patients and families that are once a week that we've kept up, but we've also kind of allowed a little check-in that we actually do every day for the group of people that were engaging before. And it's, again, something you can come in or not come into, but we hold it and we're there for a half hour each day, and that seems to be something that's helpful. But there's probably all kinds of things people are doing.
I see a comment here that engagement is a two-way strategy. It's partnerships that believe that. What is being done to ensure the participation of families in the care of their loved one? And I think that is so vital. And I think it would be really important to gather and collate this information to know what's being done, not just in Canada, but in other places, and either emerging best practices that involve the participation of family and the inclusion of family so that we can make arguments for that. I think that would be really, really interesting to find out. Just looking through more comments here. I think this is going to be an amazing resource to share all these comments. Just the chat box that popped up with so many things.
Yes.
Great.
I'm focusing on that too. Cheryl V. LaCruz talks about facilitating of virtual visits and that they send daily emails to the families to tell them how the day went. And I think that's beautiful, and I hope in those daily updates we're including those strength comments about how, you know, the patient was engaged through the day, or they seem to be physically relaxed despite their struggles, or, you know, whatever it is that's going to give us that connection that we don't get by not being able to be bedside. So that's beautiful that they do that daily. So thanks for sharing, Cheryl.
Yeah, that's a wonderful thing. You know, we've got to find ways to include and to share the good things and not just kind of clinical stuff. You know, and recognize the needs of What would, if we were there, what would be the things that we'd see or we'd focus on too as family members? And
Amy,
that you only know about. Go ahead. As I say, those are the only, you only know what things families want to hear or need to hear about when you engage with families first to say, what do you need from these check-ins?
Yeah, I noticed that Amy from Ontario Health says that they've created a patient and family advisor table as part of its COVID system response structure. So that's terrific. That they have the foresight to make sure that they continue to maintain that patient engagement in the current topic matter is really important. And I'm also seeing that Shailene is making a suggestion to peer-to-peer support. As a person with lived experience living with bipolar and PTSD, I can't say enough about how much peer support means to me, and being able to dialogue is so important. And so, yeah, I can't think of a better use for peer-to-peer support than at this time.
And keeping in mind, Denise, how small the act can be, right? So even just the fact that it could be just a little email, right? It doesn't have to be a very lengthy, just knowing that people are thought of and are valued. I think there's ways we can show that, whether it's peer support or clinician to patient or family as well.
Yeah, well, it's that vital piece. It's that vital piece of asking patients and families what they want. I'm reminded of a project that I was on, a research project on a genetics thing, where the researcher thought that the parent wanted this big, long email information, but they just wanted to know like a 2-line about where the research project was at, right? So you need to check in with patients and families to know what they want and not make the assumptions. I'm just being mindful of time, and I think we need to move on to our last question. And Denise, did you want to frame that one?
Sure.
We want to question 3. Okay.
Is that slide? Oh, there we go.
I think
we're all advancing slides. Question 3. There we go. So now, of course, and this is a statement you'll all agree with, that now more than ever, we're experiencing trauma and barriers to care. And so the question is really about how do we change what we do in engagement to hear those voices, and how do we remove barriers to hear diverse voice and ensure safety and engagement. People are diving right in, which is terrific to see. One that's standing out to me is we use gardening meetups and discussion as a stress-reducing tool and community collaboration and pick. I love that. Talk about thinking outside the box. I think that's absolutely wonderful. So thank you, Anne, for sharing that. That's really unique. And as an Indigenous woman, any opportunity to connect with the land and get your fingers in the dirt is a good thing. So I really appreciate that. I guess the part for me is not just about how are we changing the way that we engage. Maybe we don't need to change the way we engage. Maybe we need to just get back to doing it. And creating the time and the space. And so I have a brother-in-law who works in the healthcare system here in Kamloops, and he actually said that for the first time in his career, because they cleared the whole hospital really to prepare for COVID and haven't seen the number of cases that they had projected at this time, things have slowed down. And so now is that opportunity to educate yourself on trauma-informed care, explore your cultural competency, engage with patients and caregivers virtually if required, but getting opportunities for them to get their voices in. I think there's a lot we can do to remove barriers during this time. that within the healthcare system itself, perhaps we have an opportunity to dialogue in ways that we haven't before.
Yeah, I think a lot of it is taking that time and doing our own work to understand where the gaps are, and that the way we engage can create barriers or can get rid of barriers, and looking around to see who is included and who we are not including. And that's the kind of work that just needs to continue doing. And the way we need to engage in many ways now using technology and such needs to may by its own nature exclude some people. So we just need to think creatively about how to connect with people, that if Zoom doesn't work, then a phone call might work, that we need to think of different ways so that we don't constructively exclude people.
I mean, it's interesting, even with technology, sometimes you can still integrate. So we found if we want to have a meeting like that and someone doesn't have a computer, for example, and they can't even manage the phoning and putting in the toll-free and the code and everything, that some of these softwares can actually call the person so they can still participate, right? Or having some kind of meeting after to watch a video and talk through it with somebody over the phone to help them understand it. I saw a question that came up before just around how we help to engage those organizations that have kind of paused and said, well, we don't have time for the patient-family engagement piece right now. And I think certainly what I'm hearing from everybody here is this is exactly the time we need to be doing this, and that's the reason why we need to be doing it, because the impact of neglecting it is going to make things so much worse potentially, and also risk us, working on the wrong things or designing things in the wrong way so they're not going to be effective. So I think there's enough, so long as we're flexible, the people are there and available to do the engaging with us, and we just need to show examples of how doing so, I think, makes a big difference.
And I really appreciate what you said earlier, too, that people feel that engaging means they have to commit, or they feel badly if they need to back out or only do a certain thing or be flexible. I think allowing for flexibility at any time with patient and family partners is important, and it's magnified now. So I think that has to be part of the way that we do things regardless when it comes to patient-family partners, especially those that live with disability and chronic illness, and even more so now. So I think that that helps people to want to partner with us and be comfortable with partnering with us. So I'm just taking a look at time, and I think that we need to probably head to a close now. We're not quite at an hour, but we're at what would have been an hour had we started on time. So I'm not quite sure about how that webinar works, if they're going to cut us off or something. So I would like to thank all of you for joining. I'd like to thank my wonderful co-host, Denise. It's been an absolute joy working with you. I'm so grateful for you. And to Yona for just being a wonderful guest and having so much wisdom. Thank you both so much for doing this. I also would like to really thank our webinar team, and to Isabel for making, I call Isabel, other Isabel on our team, for making these webinars possible and providing so much support. And to Haley and our team for monitoring the chat boxes. And also just like to thank all of you who have joined us for all of your insights and commentary. We will be posting all of these, as well as some resources that we missed at the chat boxes but didn't get in there because we all went too fast, and we'd like to have so much more stuff to say. And we would like you to please, hold on, we've got a poll for you. Your feedback is invaluable to us for our future webinars so we can make them better. So please take a moment if you have time to put your opinion here. We have our question 1 is, overall, I was satisfied with my webinar experience. So question 2 is, I will be able to apply what I learned from this webinar in my workplace, or if you're a patient partner, in the work I do as a patient partner. I think I would like to reword that, actually, as a patient partner. And question 3, do you have any other comments or suggestions? So thank you very much, and thank you for joining us on today's session. Well, thank you all, and have a wonderful day, and please be well and look after yourselves and your families.
Thank you, everyone.